Hello, my name is Jordan Place, and I'm bringing you a question involving cystic fibrosis and pain. One experience I've had repeatedly is cystic fibrosis patients who refuse or put off important treatments such as airway clearance and inhalation medication due to increased pain. Many times, a patient will ask that the pain medication be given prior to percussion therapy, and I am usually happy to oblige. But with difficulty maneuvering both my schedule as well as the nurses, sometimes this can fall through the cracks. This can harm patients over time. So my question is, in cystic fibrosis, does the use of pain management help reduce CF exacerbations? I believe if patients with cystic fibrosis have a more focused and catered pain management protocol, then there would be less instances of refusal or delayed airway clearance. But this extends further than just physical therapy, such as daily exercise, activities of daily living that could affect the patient's overall quality of life. Pulmonary health can affect exacerbations, yes, but mental health and physical health are also important components on whether a patient has exacerbations or how severe they can be. My approach was to look for articles that involved CF patients and some component of pain. Unfortunately, many articles didn't focus solely on pain, but included it as a component to their research. Despite this, the impact of pain on cystic fibrosis patients' lives is clearly evident, and in some cases played more of a role than the researchers had anticipated. One difficult aspect that arose is the fact that pain is such an individual experience, so relies on the patient's own interpretation. Because of this, surveys were heavily used. It can be hard to tell with some patients their tolerance level, which can affect the overall results. If two patients experience the same pain, but one tolerates it or writes it off more easily, these patients have varying results. Two studies that focused on pain and quality of life, one with adults and the other with adolescents through various surveys. In some circumstances, these surveys were followed up on with patients that experienced an exacerbation. Adolescent CF patients' charts were also followed to track hospital stays. Though children tended to have less severe pain than their adult counterparts, there is still a direct correlation found with increased pain related to exacerbations, finding patients that experience more pain tended to have more pulmonary exacerbations. A systematic review of CF patients and pain was performed using 16 different articles. However, this article did not focus on a particular age group. Because of this, results were wildly different, though one area did show similarities. Pain affected patients' ability to participate in treatment, whether they were adolescent or adult. A randomized controlled trial also found a correlation between pain and treatment participation, but found that more patients found certain inhalation treatments painful as opposed to airway clearance. Though only a few articles show a direct connection between pain and pulmonary exacerbations, we can see in all of these a cascade effect. Certain aspects of the disease cause pain. Because of this pain, patients are unable or unwilling to participate in treatment plans and further have difficulty in daily living. This leads to a worsening condition and subsequently decreased quality of life. So, if pain management were to become a more focused part of a CF patient's care, then all these areas could be prevented or improved. Oregon Health and Science University can be an example of how hospitals can integrate an algorithm in order to manage CF patients' pain, not just with opioids, but with anti-inflammatories or non-conventional means such as massage therapy or acupuncture in outpatient setting. Hopefully, with the implementation of increased pain management, patients with cystic fibrosis can find less hospital stays and more quality of life.